everyone. Welcome to Elevate, your local resource for connecting with wellness experts and businesses along the Grand Strand. I'm Rachel, health and life coach, and this is my friend and co-host, Nicole Huckabee. Hi, Nikki.
Hi, Rachel. As a former news anchor on the Grand Strand, I'm beyond excited to be on this journey with you. So if you're curious about our local resources for holistic wellness living, Elevate Podcast is your go-to resource.
On this episode of Elevate,
one major thing, especially with young people, put the devices down and get outside. We're out inside, our postures are suffering, our eyes are suffering. Young people are becoming more and more nearsighted because of that screen activity all the time.
Today's guest is Dr. Joanne Jeffers, a dedicated optometrist who has been serving the North Myrtle Beach community since 1994. She now leads her practice, Inner Vision Health, in Little River, South Carolina, where she offers comprehensive eye care, from exams for glasses and contacts to specialized low vision services for patients with conditions like macular degeneration. Dr. Jeffers has a special focus on dry eye and ocular aesthetics, blending traditional optometry with innovative approaches. Beyond eye care, she's also certified in clinical hypnotherapy, craniosacral therapy, and OnDemand, a pulsed electromagnetic field therapy, bringing a truly holistic perspective to her practice. Welcome, Dr. Jeffers. I am so excited to have you on the show today. We're going to be exploring some truly fascinating topics, from ocular aesthetics to craniosacral therapy and even hypnotherapy. And I know our listeners are going to gain so many insights from you. So thank you for joining me and welcome to Elevate.
Thank you. Thank you for having me.
Yes, I'm so excited. I want to jump right in because you offer so many unique modalities that complement a holistic approach to optometry, and there's a lot to explore here. Can we start by talking about clinical hypnotherapy, how it works, and how it fits into optometry?
Sure. I first got into hypnotherapy for years as an optometrist, doing eye exams, seeing patients who smoke with eye problems, macular degeneration, very dry eyes, irritated eyes, contact lens wearers having many issues because they smoke. It's an irritant. And I used to tell them, especially with macular degeneration, that you're affecting your eyes adversely by smoking. You need to try to quit. And they would say, Doc, I want to, I don't know how, I can't. So finally, I learned about hypnotherapy and thought, what a cool modality that would be to explore the subconscious mind and to help people with any sort of problems besides even just smoking cessation. So I went to a school. It was a very, very good school. The instructor's from Wilmington, Bryn Blankenship. She's amazing. So I went through 3 different long weekend training sessions and learned how to become a clinical hypnotherapist. It was amazing. So now I do have a very powerful modality to offer smokers to quit smoking with their hypnotherapy. So that's how it relates to the eyes.
Yes, so interesting. Do you have any particular patient stories that you've seen, the positive outcomes from implementing that particular, well, I guess you wouldn't call it modality, but a therapy for them and their eye health?
Yeah, well, the quitting smoking was amazing. I had one lady in. She was a very nice lady. She'd smoked for years. And after 2 sessions, she had quit smoking. But in the second session, the part of the hypnotherapy protocol is to do a wounded child segment. And she went back to that wounded child, and she must have had some pretty serious issues because she started crying and she was like, Mommy, Mommy. And then I just said, what's going on? You kind of roll with it, try to take the angst away from that, take the level of frustration and just try to take that down. And we did that. We came out of the session and she said something powerful. She said, I have been through years and years of clinical psychology and psychiatry and counseling. And you've done more in one hypnotherapy session to quit smoking than my counselors have done in years. Thank you. I'm like, wow. That right there is how powerful that this modality is.
Wow. So right in the beginning here, it's just amazing to see the connection between how some of our unhealthy habits can contribute to unhealthy eyes and eye health. And we just don't typically make that connection. I know I never made the connection between smoking or smokers and eye health. So that's really interesting to know and then hear how beneficial the clinical hypnotherapy that you do is. That's wonderful.
Mm-hmm.
Another modality that you use, and that isn't a usual part of traditional eye care, is OnDemand. Did I say that right? OnDemand?
You did. Yes.
So this is the pulsed electromagnetic fields. Can you break down how that works and then how it supports eye health?
Yes. If anyone, I tell my patients, if you want to look up anything about how this works and how really good it is, just internet search PEMF, pulsed electromagnetic frequencies. Google PEMF and anything, any disease, anything you want help with, and you'll find a lot of information about it. The one I have is called OnDemand. That's Latin for wave medicine. It was developed in Austria and in Germany by a very smart man, and he has an entire group of doctors that have worked with him, and we feel through the pulse of the patient. The pulse, the smooth muscle that drives the pulse and the arteries is innervated by the nervous system that goes throughout your whole body. So you can feel how the body's responding by feeling the pulse. So actually they're there and they have this, they don't feel anything, it's not painful, but I have them hooked up to a sensor and I'm feeling through their pulse how they react to all different frequencies that I'm introducing through that little sensor. And I'm feeling through the pulse for a little blip or a little reaction of some sort. Chinese medicine uses this for years, but you wait for a reaction, you record that frequency. It's like offering the body a menu, like here's all these frequencies, what do you like? Oh, you like that one? Okay, I'll record it. Oh, you like that one? I'll record it. Then you go back and whatever the groups of frequencies were, you can test which one's the most reactive to the patient. And then you can tune that frequency. In other words, everything is frequency. Our bodies, every cell's vibrating at a certain frequency. And you want it to be at the optimal frequency for health. If it gets out of tune, much like a symphony orchestra would be out of tune, if the horn section's out of tune, the whole symphony suffers. Same with our body. So I've been trained to and I've learned, and I'm very grateful that I have the ability to kind of fine-tune the orchestra of the body's frequencies. It helps people with relaxation because stress is so pervasive, and decreases inflammation. It helps with a lot of different, again, Google PEMF and anything, and you'll find a lot of.
Yeah. And how has it made a difference for your patients and particularly their eye health?
Mostly by decreasing inflammation in the body. Our bodies have an inner physician. Our bodies know what to do if it's imbalance.
I like that. I like how you said our body has an inner physician. It really does tell you what it needs.
It does. So if that can decrease the inflammation of the body, your eyeballs aren't just separate from your body. Your eyeballs are part of your entire body. And it does help mostly with the decreasing inflammation.
And that's really where holistic optometry comes from. You're looking at the whole body to find out what an individual is needing.
Right.
And inflammation is really the root cause of all disease.
It is.
Yes. So your patients don't actually feel the EMF, or do they feel something at all? Or do you just, what's the experience like for the patient?
Everyone's different. I'll tell you, when I do it to myself, I feel like a quickening. I feel like all my cells are just, ooh, I like this, or jumping for joy. So it's like, wow, this is cool. One lady, she feels everything. She's amazing. Every time a frequency changes, like, oh, now I'm feeling it in my knee that had surgery. Now I'm feeling it in my shoulder where I have arthritis. Oh, now I'm feeling it in my thumb. I mean, she is so fine-tuned into her body. She feels it everywhere that's targeted. Another one of my clients, he says, I'm always feeling it in my toes. His toes tingle. No matter what I run on him, whatever frequency, his toes always tingle. But most people feel a little bit of like the quickening, like, wow, cool. It's just a really cool feeling.
So I can see with the different therapies and modalities that you offer, if somebody has, habitually smoking and it's something that they truly want to be able to quit, where the hypnotherapy for smoking cessation is applied, when do you suggest EMF for your patients? Or is it part of your care, their typical eye exam and such? How is it implemented in their plan of care?
If they're open to it, a lot of times people they come in because they want their DMV form filled out. They couldn't pass the eye test. And now other people come in saying, wow, this is a cool place. What else do you offer? And then we enter that conversation of what else I offer, what it can do for them. In fact, the PEMF with smoking cessation, they actually have a protocol for that. So I can do the hypnotherapy along with the PEMF for even more reinforcement on quitting the smoking.
So it's a compliment. It complements. They complement each other.
Exactly. Exactly. Yes.
Mm-hmm. And I have to say that when an individual walks into your practice, it is not your typical optometrist office. You feel like you walked into a spa.
Mm-hmm.
You have the
Mm-hmm.
essential oils and the little, I don't know if you have a fountain or the trickling water. It's just very calming and welcoming. It's not fast-paced environment. It's a lovely experience.
Thank you.
Yes, of course. Let's talk about craniosacral therapy. I'm so curious about this. For those who may not know what it is, how might it support eye health and how do you connect it with optometry?
Good question. I learned that I have a rule of threes. If I hear something I've never heard of out of the blue 3 times in a row, I think it's a message. And I heard about craniosacral therapy within a short period of time, 3 times in a row. I'm like, what is this? I don't know what it is. I researched it, I looked at it, I'm like, wow, that's pretty powerful. Let me learn it. So again, I went to 2 different seminars for long weekends and learned it, practiced on other people. The craniosacral system is actually the cerebral spinal fluid that bathes our brain and our spinal cord. It forms a semi-closed hydraulic system. And it has a rhythm, we found out, where it's emptying and filling at about 8 to 12 cycles per minute. So, and as it fills and empties, it's moving your long bones very imperceptibly, but I've been trained to feel for that. So I can feel for that rhythm in certain parts of your body just by very gently touching those parts. And I can tune in and I can actually feel that rhythm. And I'm assessing its rhythm, its frequency, its amplitude, its symmetry between both sides of the body. So I'm assessing that. Then I've been trained with a very, very light touch. They tell you no more than the weight of a nickel. So it's not a massage. It's you're fully clothed. You're on my massage table. And I'm very gently feeling for restrictions in the body. For example, like in the thoracic area. So I've got my hand here and I've got one behind you. And I'm kind of energetically feeling my hand. Sounds weird, but kind of go into the body and I can feel a twist. And then they call it direction of energy. I'm also trained in Reiki. I call it Reiki. You just put some healing energy into it. Mm-hmm. You can actually feel it softening, the fibers lengthening, and it just releasing. And you do it to 5 different parts of your body, the base of your neck. That's the most relaxing one. And then on the skull, we use different parts of the skull as a handle to gently lift. They found that the skull does not fuse like a coconut as it grows up. Histology is a study of cells. They found that there's movement, very subtle movement between the different plates. So we use that to kind of, again, release any restrictions to free up that movement, so that there is a more freedom of movement of that craniosacral system. We're balancing it. I'm trying to even both sides of the skull out so it's evenly done. Then at the end of all this, it takes about 45 to 50 minutes. Then I go back and reassess that craniosacral rhythm. And I always will find an improvement in it. What patients feel, very relaxed. Most people start snoring. It's kind of cute.
It's kind of cute.
And how it relates to the eye, there aren't any studies on this, but there's anecdotal evidence and there's just people doing this. People with, sometimes with eye muscle problems, you can sometimes straighten that out just a little bit. I can't cure an eye muscle problem, but I can help release any restrictions that might be contributing to it. And there's an interesting theory that your optic nerve goes through an opening in your brain. Part of that was with the frontal bone. So the frontal bone is one of those openings the optic nerve goes through. Now glaucoma is too much pressure to damage the optic nerve and nerve fibers. So there's some theories out there among craniosacral therapists that if we can release the pressure on that opening where the optic nerve is by releasing the frontal bone a little bit, we're taking pressure off the optic nerve and we may mitigate or lessen some of the damage the glaucoma is causing. So there are direct eye relations.
That's wild.
Yes.
So it sounds like,
yeah.
I can imagine that it feels like you have a release of pressure and tension. And I can imagine it feels healthy for the body to kind of get back to a sense of balance without that. And also releases inflammation, I'm sure.
Yes.
Right?
Yes. Mm-hmm. Yes. It's a very relaxing thing. And I've actually taught patients who are aware of this how to do their own frontal lift with glaucoma. If you have glaucoma, just do this. Just take a very gentle frontal lift. I've taught them how to do it. And again, I don't have any studies that show that it does. It's hard to get a controlled study on that, but it doesn't hurt.
Sure.
It feels good. Mm-hmm.
Is there a particular group of people, patients like children with vision development challenges or adults with chronic eye fatigue that this would be most beneficial to. I'm thinking someone that even has migraines and eye strain. Those two are often connected right there.
It's not going to hurt. It's going to help mostly by relaxing. It's going to help by once that craniosacral rhythm or system is balanced. Again, the inner physician, the body knows how it's going to feel to be balanced. All of what we're doing now is about homeostasis, which is balance. Once your body's balanced, there's less stress, there's less inflammation, there's less eye strain, there's less migraines, there's less any of that. So yes, it does help. It does contribute to helping people who suffer from those who are afflicted or not afflicted, who just have those conditions.
Sure. I can imagine. So since it works on releasing restrictions and opening things up in the head and then the facial areas, does it help with dry eye, conditions like dry eye? That can...
Not so much. That would be nice if it did. I mean, again, it's not going to hurt. But to target dry eye, the cause of dry eye is so many different things. The glands, the lacrimal gland, the meibomian oil glands, the muscles around the eyes. It's going to maybe help. You know, that's a good question. I really don't know.
Well, I mean, that's where we, move forward. We progress from where we are is when we're not sure of something and we kind of dive deeper into that, right? And the reason just listening to you, the reason I asked was because isn't dry eye also caused from like tension and imbalance in the muscles around the eye? Or I could be completely wrong. Why don't you explain a little bit about dry eye disease and how common it is? Let's start there.
Yes, dry eye disease is extremely common, especially as we're getting older. The mechanism behind dry eye sometimes is a misnomer to me because people come in, my eyes are always watering, doc. I'm like, well, your eye's dry. No, it's watering. It's a dry tear film.
Right.
Okay, there's two types of tears. There's your tear film that you make when you blink. The act of blinking, the muscles that make your eye blink, push out the things that belong to your tear film, the oils out of the meibomian glands that line your eyelid margin, the lacrimal gland, that's the water gland. There's goblet cells, there's mucus cells in there. So it's releasing, among other things, oil, mucus, water. The act of blinking does that. Now all those levels, all those layers have to work together. If one layer doesn't do its job, for example, the oil layer coats the surface of the tear film and prevents evaporation. If you don't have enough oil in that layer, the tear film is going to evaporate, or what we call break up, very quickly. I'm measuring breakup times in some people of 2 seconds, and it should be about 10 to 15, which is your average blink rate. So they blink and their eye film dries up. They're going to have a dry tear film. Symptoms of a dry tear film are watering. Okay, your eyes are, all of a sudden your brain gets the signal from your eyes like, hey man, it's dry down here, and your brain's like, ooh, we better water. So it starts the reflex tearing, which is too watery, it just runs out. So you have a watering eye because of a dry tear film. Okay?
Interesting. Okay.
Yes. And that's the cause of the dry eye. Now, as we get older, the hormonal changes. I think after about the age of 30, but most of our facial muscles start to sag a little bit. They lose their tone. We've seen it. My face isn't a 25-year-old face anymore. I wish it were, but it just isn't. So that's part of the getting older as we get older process. And so the muscles around the eyelids start to sag a little bit. Your blink isn't as efficient. You need your eyelids to be right up against your globe to have an efficient blink. If the lids are getting lax or loose, you're not going to have an efficient blink, and you're not going to distribute the tear film as well. You're not going to push the oils out, the water out. It's not going to be as efficient. Mm-hmm. So part of treating a dry eye involves a lot of that.
Yeah, and I'm sure, not just with age, but also screen time, diet, the environment, all those things can play a factor and having dry eye.
Absolutely. Back to smoking. Smokers have a lot of trouble with dry, irritated eyes. Screen time's a big thing. They've actually paid money for people to do this study to say, okay, if you're on the screen time a lot, what's your blink rate do? Well, it goes down. You're paying attention to one thing. You don't blink as much, and your tear film gets even more dry. You're just not blinking enough to re-wet it. So they have this so-called rule of 20 now, that every 20 minutes, set a timer, take at least a 20-second break from what you're doing, look at least 20 feet away, which is relaxing the focus of your eyes. And I tell people, get up, stretch, and blink 20 times. Get that tear film going. So yeah, screen time is a big contributor to dry eye.
It just leads me to ask you this as well. I have a pair of, they're usually right here, of blue screen glasses that if I feel like my eyes are getting tired, I will put them on for a little bit. Mm-hmm. What are your opinion on these? Are they helpful?
Yes, and there are some that are better than others. Some let some blue light through, some let a lot of blue light through. Some have different, again, it's back to frequency. there are certain frequencies of light you want to block for the best filtration of those harmful rays of frequencies of light. There's a company called Therapies that I use. They have a lot of different frequency tints, which are different colors of tints. Frequencies are colors too. And there are some that are perfect for some people. I have one of my friends, every time she's on a computer and she needs to do it for a job, it triggers a migraine. So these Therapies help her. Takes away the trigger for the migraine from the frequency of light being emitted from that device to her brain. I use just a regular blue light blocker. It's like an orangish tint because it's blocking off the most harmful of those wavelengths of light. So yeah, Therapies. But anytime someone gets a blue light blocker, it's going to help. It's just how good is that blue light blocker and what frequencies does it block?
Sure, yeah.
Yeah, and on my regular eyeglasses that I use most of the time, not all the time, but when I have them on, I put a coating on it that has that blue light blocking technology in it as well. So
it's good to know.
Yeah.
Because I wear these, but sometimes I'm not quite certain if they're I need to come look at your Therapies. You have them in your office, right? That's
yes.
What I need to do. I will put it on my list of things. What are the latest treatment options for struggling with chronic dry eye?
Good question, and I'm very excited about this. For a little while now, I have invested in 2 different devices that help. One is called IPL, Intense Pulsed Light, with LLLT, Low Level Light Therapy. It's all based on red. The red light therapy now is coming on pretty much everyone's radar.
Yes.
It's very, very helpful. It's very healing. Red light in itself, what red light does, it uses different frequencies of red light to promote healing, to help skin conditions. It goes deep enough into the skin to get the mitochondria function again. The mitochondria are in every cell, and they're like the generator of the cell. If the generator of the cell is not running, there's no fuel, there's no energy, it's going to sit there and get stuck. And it's not going to be able to take in nutrients or get rid of waste products. So if you wake up that mitochondria, you get the cell moving again. That's going to decrease inflammation. It's going to actually tighten up skin a little bit. It's also going to help healing any kind of wounds you have, scar tissue. It increases ATP, which is the fuel of the cell. And it makes collagen production. We need collagen. We lose collagen as we get older. It stimulates collagen production. So what I have, it uses IPL, the intense pulse light, and I target the meibomian glands. The meibomian glands are the little oil glands that line our eyelid margin. And meibomian glands should produce something like an oil slick. Most of the times it's blocked up. It's not oil, it's toothpaste. Toothpaste doesn't come out of that gland when you blink. It's not coming out because it's too thick. It's toothpaste, it's not oil. So we need to soften that up. Classically, all we've had are hot compresses and lid massage and lid cleaners and eye drops, it works, but it's a bit tedious. So now when I do this IPL, again, you want about 2 or 3 or sometimes 4 IPL sessions about a week or 2 apart, and I'm targeting those meibomian glands. It's adding heat, which is melting that back into oil. It's decreasing inflammation, and it's helping those meibomian glands function again. So after we do that with each eye, then we put a mask on them from the same company, and it has the specific frequencies of red light that are very healing to the eye. And again, that's decreasing inflammation. It's helping collagen production. It's helping that tear film really produce oil to go back into that tear film. So it works mostly with meibomian gland dysfunction, we call it. That's very powerful. It's worked very well. After I do that, sometimes I kind of push on those glands to get the oil started to coming out, and you can see a big difference. So that's one thing. Now, another one we just have started implementing is the company's called Optolift by Luminous, and it uses dynamic muscle stimulation and radio frequency. That dynamic muscle stimulation uses, you have a little probe you put on the eyelid margin, and it's using it's electrical impulses that stimulate the muscles, and you can feel the muscles kind of twitching, and it's like working out those muscles, making them strong, like taking them to the gym. I'm activating those muscles, making them stronger, pulling that up, making the skin tighter. The muscles work better. The muscles contract and it enhances toning. The radio frequency is adding collagen. This radio frequency kind of heats up the water in the cells, and when you heat that water up, it creates friction, and that friction creates more collagen and elastin, which is tightening the skin. So not only am I helping the tear film, I'm helping, there's the ocular aesthetics. I'm helping the appearance of the eyes by lessening the loose skin here, the bags under the eyes, the skin up here. So it's a great alternative to surgery. All these years, like I said, well, you've got this skin thing going on. Oh, yeah, all I've got is surgery. I'll have to refer you. Now I have something that really works without having to go through surgical options. So I'm excited about it.
That's a great transition to ocular aesthetics.
Beauty should look good, feel good, and be good for you. That's why we sat down and talked with Jessica Aji from the Styling Room. With over 25 years behind the chair, owner Jessica Aji has built a salon dedicated to sustainability and well-being, partnering with international B Corp brands to bring you the cleanest products and services possible. Because when beauty is elevated, so are you. Now back to our conversation.
I like this one because people getting Botox isn't healthy for you. A lot of people get it, but I don't like injecting poisons into my skin. And I had one patient years ago who she came in, her eye was all the way closed. She couldn't open it. I'm like, you can't open your eye. I could open it, but she said she had Botox and it paralyzed the muscle in her eye. And there's nothing we can, I said, you have to wait till it wears off. I'm never getting that again. So, I mean, there's always side effects or risks of things, but I've also, with this Optolift, this dynamic muscle stimulation, has come in microneedling. So you can do some microneedling, like the little furrows in your eye, and that is one modality that helps too. It's very aesthetic.
That's what I
The
need.
Optolift,
I have that little.
yeah, it's great. The pensive look, I like that. But yeah, the Optolift can help that too. And actually, the Optolift can do your entire face. It's about a 15-minute procedure to do with both eyelids. Okay, 7 minutes here and 7 minutes here, 14 minutes. In about 25 minutes, I can actually do the whole face. And that, again, is stimulating those muscles to tone the muscles. So you can get rid of some of this nasolabial folds here. And you can tone up the muscles around your eye, your face. It's like a little mini facelift for you. It just tones all those muscles.
Yes, so that's the aesthetic part of it. However, it really is primarily for you a health benefit for, tightening up the eyes, being able to blink better.
And also patients with rosacea. Rosacea patients very, really much benefit from, actually from the light therapy, from the first instrument I was discussing, the IPL. And the low-level light therapy is wonderful for rosacea patients. Rosacea causes a lot of inflammation around the eyes. You get a lot of styes. You just get a lot of dry eyes. Get really red eyes because of the rosacea causing all that inflammation flaring up. This helps a lot with that. So it's a really, really good modality for rosacea.
How interesting.
Mm-hmm. Yeah.
Yes, for anyone that doesn't have rosacea, you otherwise wouldn't know how it can affect your eye health with dry eye or styes. Styes are, I hate those little things. They're so aggravating.
We all do. They're tender, they're ugly. We're like, oh, yes, but I have a modality now that helps. And if you do get one, it will also make it go away quicker. You deliver that IPL right to the sty or the area where it's swollen and inflamed, and it dissipates it much quicker.
Can we back up for a half a second and talk about Botox? I feel like that is a very juicy topic, a little bit controversial. We have some that already are doing Botox. We have young adults that are exploring Botox, I think mainly for aesthetic reasons. And then, we also have some of our holistic practitioners share that it is toxic. It's not healthy. What say you? Can you share a little bit of your insight on that?
Yes, again, I'm kind of new to the microneedling technology. I've known about it, but I've never really researched it or looked into it. Now that it came with this Optolift that I have, and I've got the microneedling technology, that is a great alternative to Botox. It's using needles that just penetrate a little bit into the skin. I had it done to myself. You could feel it, but it's doable, totally doable. A lot of people who have had microneedling before, it's been very painful. The one I'm using now also uses that radio frequency, which is kind of like putting a blanket around that needle. So it's not nearly as painful, or you don't feel it as much. Your forehead's, though, where you'd feel it the most. In my case, it was interesting. When it went over the forehead, I just had a sneezing fit. Like, I just couldn't stop sneezing, but it didn't hurt. It wasn't horrible, but it triggered a sneezing fit. It was funny. We just kept laughing and sneezing. It was funny. But I could see a big difference after that one microneedling treatment. I could see less furrow here. My skin felt a lot better, a lot tighter. I'm anxious to go through a couple more to see how much more benefit I can get from it. So this is a great modality. So instead of Botox, it's going to achieve the same thing without the poisons in your body, without injecting something toxic into your skin.
Yes.
And the one thing about it, if you do have Botox, you have to wait 2 weeks to get this microneedling procedure done. And if you have any fillers, you have to wait 3 months.
So how is the protocol different than Botox? Do you go the same amount of frequency, visits? How does it compare?
We usually do, they say, one visit per decade of life. So if you're in your 20s, you'd do two. If you're in your 60s, you'd do six. Okay, so you would have, so I'm in my 60s, so I would have six treatment modalities about 2 weeks apart. And after that sixth one, I'm going to see a huge difference. Then for maintenance, every 6 to 12 months, you might want to go back and get it redone. But it has a good lasting effect. So for the Botox people, say I've got a 25-year-old girl who does Botox and she just wants to come in and do this instead. Well, I would have 2 sessions on her, and then on the third one, I'd say, "What do you think? Do you want one more, or do you want to wait and see?" And then you just do maintenance. Sometimes it's up to the patient. We are all our own worst critics. I look in the mirror, I'm like, "Where'd that come from?"
Mm-hmm.
Excuse
Mm-hmm.
me.
Mm-hmm.
So these little young girls, they're so beautiful, and they look in the mirror like, I don't like this, and they want to get something done about it. So if they say, "Hey, doc, I've noticed this now, it wasn't there before. Come on in, let's take care of it."
Yes.
So, yeah.
Well, we live in an age where living through a filter is what, I don't know, is both popular and becoming the norm. Whether it's you filter how you're doing, or you try to filter your pictures, or you filter with Botox, or whatever you're doing to feel more youthful, look youthful, more handsome, more pretty, instead of leaning into your natural self. It can be a bit of a
aging
struggle
great,
there. Aging gracefully.
aging gracefully. Yeah, and like
What's
my guy Jack says, he's like, natural beauty is better than made up beauty. Natural beauty, and as you get older, it's still beautiful. That's what you do. He says,
yeah.
yeah, and I think that's true. But some of us, me, myself included, I'd like to take care of some of these little, lines I don't like.
Yeah, it's natural.
But with the tear film, oh my goodness, see the big improvements in the quality of these patients' lives when I can get their tear film normal again. I've got one lady coming in next week. She's had a lower lid that's kind of drooped down so much that the little opening that collects her tears is unable to collect her tears. So whatever tears she's making just run out down her cheek. She's always carrying a Kleenex, and she's always got this redness down here just from being irritated by that leaking tear film right down her cheek. And the only option I've ever had for her is surgical. I've tried the IPL, LLG. It helped her meibomian glands, but it didn't tighten that lid up. Now she's coming in to have the OptiLift with the direct dynamic muscle stimulation to tone that muscle back up, to try to get it tight up against the eye again. I'm very, very anxious to try it on her and see how much we can help her. It's life changing.
Yes, and it also helps with the droopy lid, correct?
Yes, correct. Yes.
We have
So
that
I've
in
had
our
people
family, and I can see that. I'm like, where are my eyelids going? They're drooping. They're going the wrong direction.
It does help with that. It makes a huge difference. So again, it's a surgical option to having called a blepharoplasty. They cut and tighten that skin up. You don't. Yeah, I'd rather not have that. I'd rather use the muscle stimulation and tone those muscles myself.
Yes. Well, you avoid anesthesia and all other things, and a knife near your eyes. Just
Right. That's
the
exactly
thought of
right.
it's healthy, and that's what we're aiming to do, is talk about and dive into the healthiest options and the most optimal health benefits that we can achieve just doing what is most natural and realistic for us as individuals. So OptiLift is pretty amazing. What's
It
one
is.
piece of
It really.
advice that you would give someone who is struggling with both the look and the comfort of their eyes?
To realize that there are ways you can help with the technology now. There are modalities we have that we've never had before. I mean, this is brand new technology. It's cutting edge, and to me it's amazing, and it's going to be fantastic to be able to help people who've not had anything to help them before. Again, if someone has the dry eyes and they're just suffering from it, all I've had are warm compresses, moist heat, lid scrubs, and put eye drops in, and now I have a way of helping them beyond that, better than that. And just realize there's ways you can help all of that. I can tighten that skin up. I can make you look more youthful and improve the quality of your blink. And you won't have as many of those awful symptoms of dry eyes. The watering, the redness, the burning, mild itching. I mean, I've had dry eyes before, and after I've had the LLT and IPL, I've been fine. I thought I had a lot of allergies before because my eyes were always itching. Way less itching. So just from the tear film quality improving, it's helped the allergic response my eyes have to pollens.
Oh,
So that to
wow.
me, Yes. Yeah, with the better quality tear film, it has more defense against pollens and less infection, less propensity to get styes or chalazion. So yes, quality of tear film is important.
Yes.
So if
Especially
you're suffering
here,
from that,
the pollen and the allergy season, year-round allergies.
yes.
Yeah. Many patients
Yes.
are curious about the financial side of care, especially holistic care.
Mhm.
Um, and for procedures that aren't covered by insurance, can you walk us through what kinds of costs people might expect and how you help them understand the value of the treatments?
Sure, yeah. I see a holistic practitioner, naturopathic practitioner. She's helped me a lot beyond what I couldn't help myself enough because knowing what I know, and I can't prescribe certain things as an optometrist. So I've seen this woman. She's really good. This doctor. She's helped me a lot, and it's expensive. She's expensive, but you know why they're expensive and insurance doesn't cover? Why holistic healthcare is more expensive? A lot of education has to be undergone by us. The educational costs. In my case, the equipment's pretty expensive. And every time I use the IPL, it has a certain life expectancy. So every time I use that IPL, I've only got like say 9,000 IPL shots left. Every time I use one, I'm decreasing from what I've paid for that, and it's quite expensive. I'll eventually have to replace it down the road, and that's okay, but that's part of the cost. The Optolift, it's just expensive equipment. One thing I tell people, if we're able to restore your tear film, they have eye drops out now. Sequa Stasis has been around forever. I've really never found much luck with it, or prescribing it for patients with dry eyes. But those eye drops cost like $400, $500, $600 a month. It's ridiculous. Wow. So if I can help their dry eyes with what I have here now, they won't have to buy those eye drops. So they have saved that much money. You don't have to keep putting eye drops in. You don't need as much anymore. So there's savings overall. Like a naturopathic physician, you don't have to take all those medications because you don't want to be on pharmaceuticals. They can put you on natural, change your lifestyle. So you're actually saving money in that respect by spending that much over here. You can spend this much over here, but you can start saving it over there. So yes, this is not insurance. So you're right.
Yeah, I often think of it too as an investment,
Mm-hmm.
and making sure I'm going to get a return on that investment. And much like you just shared, over the span of the treatments that you receive, you start to receive the benefits to where you're not having to pay for $500, $600 eye drops inevitably down the road. Quality of health and holistic care returns to you just improvement and energy, and so many things that you're able to cut back on, or sometimes in some cases even get rid of prescriptions. But I think that the return on investment is the quality of living and life.
Agreed. Well said. Yes, very well said.
And there's confidence in knowing that what you are putting in your body or the modalities that you're using are good for you, and they don't come with the same side effects that we know inherently are not healthy for us, nor do we want to be experiencing.
That's true. That's true. In fact, I do a lot of nutraceuticals for eye health. For macular degeneration, the ophthalmologist say, well, go to the store and get Preservision. It's not going to hurt you. Preservision is not poison or anything. It's not going to hurt you, but the nutrients are made from chemicals. They're not made from nutrients. So your body doesn't really know what to do with a chemical like it does a true nutrient. So it's not bioavailable. It's called bioavailability. When you take a nutrient or take a supplement that's chemical based, your body just mostly eliminates it. It doesn't go to its targeted tissue. So some of the nutraceuticals I use, I've researched where they come from, what's in them. Why would you want to put dyes, FD&C dyes in a capsule? That's poison. So the ones that we've kind of using here are much healthier. They come from actual nutrients, not chemicals. They're non-GMO. They've been tested. There's no lead in them. There's no pesticides. They're clean. They're a little more expensive because to get better quality product, you spend more to get the raw materials to make this.
Yes.
So, but yeah, another factor, the quality of the product is worth the extra money you spend because it's more bioavailable. It does a better job.
It's so nice for our listeners to know that when they come to see you, that you also provide supplementation and the quality and the research that you put into those, and the understanding that you have of what quality is versus just having that inherent knowledge of I'm taking a supplement. A lot of times there's confusion. It's like, what do I take? And it does take the knowledge of a holistic practitioner, functional medicine physician to guide us, because our bodies are all unique and we may not all need the same supplementation. Plus, we want to make sure that what we're doing is quality. So I think it's wonderful that you provide a space where you specialize in eye care and eye health, but you complement it with modalities that are often seen as aesthetic modalities, but truly that's secondary. The benefits of that is secondary. A lot of us put those as the first reason. And then you also complement it with your supplementation. And I know that you even have eye drops there, I do believe. Some other things, eye makeup remover, I noticed when I came in. I'm like, oh, I love the fact that I can rely on you to even share with me what product line is fast and efficient, because that becomes overwhelming when we think that we have to be the expert on everything. And so really that's what we're doing here with Elevate, is connecting our listeners with individuals like yourself. And it reduces the stress on us to know that you're there and available for us for recommendations like that. So thank you.
Yeah, you're welcome. Thanks for saying that. Yes.
One of the things that your patients can expect when they visit you is how much time and care you dedicate to really listening and, I think, understanding their needs. Why is spending that extra time so important to you, and how do you feel it impacts the outcome of your care? You spend at least an hour with your patients at a time.
I do. Yeah, that's a good question. I book one patient an hour. I think it's very important to sit and listen to them. If you don't, I mean, we're in such a fast-paced society, and I do not take insurance. If I were to take insurance, I wouldn't be able to spend an hour with my patients. Okay, I'd have to spend 15, 20 minutes with them. I'd have to have electronic health records. I don't. I have paper charts. I do it the old-fashioned way. I write everything down on my little chart. We file it away, and I just take copious notes. I'm not bound by the template that they have to go by with these electronic health records. Their information is not going out into the world for everyone to hack into and look at. I don't like that either. So I'm very old-fashioned. I spend an hour, I have a paper chart. Again, I'm able to spend that time with them, to sit and talk to them, to listen to people. I've had people, not just with eyes, just with their lives, tell me some of the most heart-wrenching things because they feel like they can open up. And we'll talk about it and go through it. And I think it just means a lot to people that they have someone who will listen to you, not only with your eye care, but with your life. You know, I teach people mindfulness. You know, when you go home, just don't keep doing. That's not good. Your body's under stress. When your body's under stress, there's the inflammatory process, inflammatory dry eye. Be mindful. In other words, when you wake up in the morning, most people hit the ground running. Well, you know what? Whatever your first beverage of the day is, whether it's a glass of water, a cup of tea, a cup of coffee, sit down, smell it, engage all your senses, mindfulness. Smell it, feel the texture of what your container is. Look around, notice colors, play of light as the sun comes up. Listen, I hear birds. You know, how many people don't even hear birds because they aren't mindful enough to listen? So just be mindful. Sit, just even if it's for a minute or two, and just connect with who you are, what you're doing. What does it feel like to sit in this chair? Just be mindful. And as you're mindful, just going within sometimes, when I go, close your eyes and just go within, inner vision. Go in within, you put your vision inside and listen to your body. You know, you may have certain feelings like, you know, my stomach kind of hurts. Well, what's that from? Is it from a GI upset? Is it from an emotional thing? Pay attention to it and just be mindful. And that's powerful. If we all sat down for just 2 minutes a day and just got quiet, I think we'd all be in a better space.
I think it's lovely how you mentioned inner vision, because inner vision health is your practice. And I can see now where you have brought that full circle to look within, quiet down and listen. Your body is telling you everything that you need to know and hear.
Exactly. Yeah, I love it when people sit in my chair and say, you know what, I've noticed this about my body. I'm like, yay, good. Tell me more. Let's try to address that. Yeah.
I think that also goes back to the cost of holistic care as well. We are not given that opportunity, and traditional medicine is not given that opportunity to sit down and make that connection with their patients, truly get to hear what they're saying. Patients don't feel heard, and it's frustrating for all parties. And so when you're not bound by what insurance is dictating you to do, whether it's you cannot provide that treatment or you cannot provide that amount of time to this particular patient, then they don't have the opportunity to truly see health care as it, I think, is intended to be.
I agree. Yes, totally agree with that. Yes.
Dr. Jeffers, this kind of leads us into my one burning question that I always ask. We are collecting golden nuggets this season on Elevate for what is the one thing that we can do to elevate our health and wellness today. One simple, actionable step that we can implement into our day.
One major thing, especially with young people, put the devices down and get outside. We're out inside, our postures are suffering, our eyes are suffering. Young people are becoming more and more nearsighted because of that screen activity all the time. Put the device down and just go outside. As an adult, go outside and walk around. Go to the beach and walk the beach. It's good grounding at the beach. Take your shoes off. Bare feet in the salt and the surf and the sand ground you. It releases inflammation in your body through your feet. I mean, grounding. Look up grounding. Grounding's amazing. Get outside. Walk through the forest. There's not forests here, but there are parks with trees and trails. Right here in Little River, Vereen Park, you can go right through the woods there down to the waterway. Walk your dog. Just get out. Get out in the outside and breathe. Just remember to breathe. Stand up straight and just take deep breaths. It's very, very relaxing. And get an eye exam. Okay, get your eyes checked. And there are so many things to look for and look at when you check eyes during an eye exam. I don't just look at your refractive error, like which is better, 1 or 2, 3 or 4. I do that because that comes up with a prescription for eyeglasses or contact lenses. But I also listen to what else you're telling me. I have everyone write down what supplements are you taking, what medications are you taking, and I kind of go over that with people if they want me to. It's amazing. So yeah, get an eye exam, be proactive, get outside, put the devices down, just get outside and talk to people. Yeah, I have a farm, so I'm outside a lot. People who don't have land
What a
around
lovely
them,
reminder.
There.
Thank you so much. Thank you for taking your time and your day off to be here on Elevate.
Well, thanks for having me. I really appreciate that. It's nice talking with you.
Wait, don't go anywhere. If you are enjoying the Elevate podcast, could you do us 3 favors? Leave us a review, join our newsletter, follow us on social, and wait, it's 4 things. And share the podcast with friends and family.
Absolutely, Rachel. Your reviews help us grow, reach more people, and contribute to our mission of connecting local wellness businesses with individuals seeking their support and services. Please take a moment to leave us a review. To get the most out of your listening experience today, we invite you to join our newsletter. We offer wellness-based resources, recaps, show notes, and links. It's like a culinary garden of wellness resources.
Until next time, have a healthy and blessed day.
We hope you enjoyed today's episode. The information provided in the Elevate podcast and associated materials is for general informational purposes only and is not intended as medical advice. No content should be considered a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. Reliance on any information provided by Elevate, its host, guest, or contributors is solely at your own risk. We encourage you to consult with a healthcare professional before making any significant changes to your diet, exercise, or wellness routine. Ultimately, your health and well-being are unique to you, and it's important to make informed decisions based on your individual needs.